How to fix my hollowed eyes and bags under eyes.
Thank you for your question. You've submitted several photos and you are asking how to fix hollowed eyes and under eye bags. And it's a very straightforward question with photos taken in different environments, and certainly is very helpful for me to help guide you as to what I would do for someone like yourself who comes to our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been practicing in Manhattan and Long Island for over 20 years. One of the most popular issues that we provide solutions for is under-eye bags and hollows. So just to give you some understanding as to the approaches based on what is the underlying cause. So what I would say is, just by looking at the photos in different scenarios and different lighting conditions and in different times, it's clear that there is a consistency where there is a large bulge of puffiness under your eyes, and right below it, it appears to be hollow. So what is the anatomy that is the cause of this issue? Well, the anatomy is as follows. What you're dealing with is something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat pockets that are around the eyes pushes forward, creates this large bulge under the eyes. What that means is the eyes can look puffy and simultaneously hollow. The reason why they look hollow is a combination of anatomy, that is the bone structure, and the contrast between the puffiness causing an elevation or a mountain and the hollowness right below looking like a valley, creating this hollowness. Now, the strategy that I would generally recommend when someone has relatively significant amount of puffiness is leaning towards the more definitive surgical procedure, which is called a transconjunctival blepharoplasty. What this is a procedure where we go from the inside of the eyelid and address the fat pockets by reducing, sculpting, and repositioning the fat so the fat pockets are no longer prolapsed forward. What that does is it eliminates significantly a large amount of both the puffiness and the hollowness by contrast. Now, this procedure in our practice is performed under local anesthesia with light sedation in our office operating facilities. The office operating facilities are certified by the Joint Commission, which means that the safety standards and the personnel requirements are no different than any major hospital for this type of procedure. This way you get a more definitive long-term benefit. What we also do, typically in combination, particularly for people who have lighter skin, who have had sun exposure and aging appearance of the skin and discolorations, we'll do a combination of the use of platelet-rich plasma and a laser procedure. What does that mean? Well, the platelet-rich plasma is derived from your own blood, and it is a concentration of the healing and growth factors that help stimulate collagen and blood supply and creates a foundation for healthier, better-looking skin. The laser procedure has another approach to helping the skin from the outside. What we're essentially doing is we're improving the outer surface of the skin, the epidermis, as well as the dermis or backbone of the skin. So the skin is tighter, has a smoother, fresher look because it's new, fresh skin. And in combination with PRP, it's a very powerful benefit overall. Now, there are situations in our practice that people first, because of the research that they're doing, they first want to try to approach this procedure non-invasively. And I would say that non-invasively is a bit of a misnomer, because what they're referring to is the use of fillers. And we use a lot of fillers in our practice to help people with under eye hollow and with mild to moderate puffiness. The thing is that you have to also understand is that once you enter the skin, it is an invasive procedure. Now that being said, it is less of an issue compared to having surgery because you're just walking into an exam room and having the filler placed. But you are still getting some kind of local anesthetic, and it is a procedure. We use the most minimally invasive approach. We actually use something called blunt cannulas to minimize bruising and swelling. But the placement of a filler in the hollow is something that you can entertain and maybe even do as a first line just to confirm for yourself the benefit of a surgical procedure. Sometimes patients come to us who want to do the surgery in a few months but have important events coming up they want to look good for, and we'll do the filler as a bridge to help them look better, even though it doesn't always definitively eliminate or improve and compared to a surgical procedure, but it gives them a little bit of space before they're ready to have surgery. So you have a lot of different options, and sometimes the filler can also be combined with platelet-rich plasma, which is actually a very synergistic benefit. That being said, I think that ultimately surgery will most likely, based on the photos you submitted, will most likely be the strategy that will be more definitive for you long term. I recommend you meet with qualified and experienced cosmetic surgeons who do a lot of lower eyelid procedures, who have a lot of experience with both the surgical and non-surgical solutions to help people with the under eye area. Once you're comfortable with the doctor, you may move forward and start helping yourself look your best. So I hope that was helpful. I wish you the best of luck, and thank you for your question.